Okay, so we're happy to be here to talk to you again about digital solutions and how it's kind of revolutionized our workflow at our health system. We work for St. Luke's University Health Network. It's based out of Bethlehem, Pennsylvania. We have 18 imaging sites with 33 different ultrasound systems just in radiology alone. So back in 2020, we started on an adventure to kind of change the game with quality and how we see it and standardization in ultrasound. One of the biggest issues in ultrasound is always standardization, which affects our quality. So the first thing we did back in 2020 is we decided to upgrade our entire fleet to the Logic E10s. We did that all at once. We did an overhaul. It took a couple weeks, dropped them off at various systems. And at the very same time, we implemented Scan Assist. Now, Scan Assist is not something new. It's been on, the GE systems for a long time. We just had never used it. So a big barrier to that is that it's kind of cumbersome when you first think about it. How do you implement it? How is it going to affect your department? So we decided once we're going to teach them a new system, we're also just going to implement this at the same time. So we introduced Scan Assist. Then about 9 months later, we introduced Viewpoint. And we're currently working on our Digital Expert Connect implementation, and we've done this all through Verisound Fleet. So we're going to kind of show you the different steps. So first, we want to show you Scan Assist and how it's kind of changed our workflow in our department. So this is just a little video playing in the background, but the basis of Scan Assist is an internal protocol that lets you set kind of what images and in what order you want your text to scan. So basically we implemented all steps that we wanted for every exam that we scan, every routine exam. And we have the different various steps with the labeling, with the measurements, and it all kind of connects. And you can easily see here, they're going to demonstrate to you here how it dramatically reduces the amount of clicks for the sonographer. So they're no longer, pounding on the keyboard, hitting different things. Now the Scan Assist is going into that nice order for you. So this is showing you a dramatic presentation of how before they were touching every button, they're touching multiple measurement packages, all that. Now with Scan Assist, that's kind of reduced because they're just going through the steps and it's already predetermined. So next we're going to show you on the system. We want to show you kind of a live action of what it looks like.
While she's doing that, one of the really big things for us, because we had gone to all those new units, a lot of our sonographers were coming from multiple different levels of different types of GE products and even other competitive products. So we have 70 ultrasound techs across the network, and it's hard to get them all on the same page. We're not always fortunate enough to have a really experienced tech at each site to guide the new techs. So by implementing Scan Assist at the same time, it really set up a nice pathway for them to learn, and so it's easier for them to learn the protocol. So if they're new, it gives them exactly what they have to do. And then there's some other things that Lauren's going to show. Some of my favorite features about using Scan Assist is you can actually implant images right in the step to show them what the expectation is. So we can have anatomy pictures in there. We can have this is how we want you to measure it. Your picture should look like this. So I think that's one of my favorite things about being able to utilize and put that Scan Assist into the most optimum. Go ahead, Lauren.
Yep. So you can see here's all your steps here when you're looking. You can build in your steps, and there's obviously an internal protocol on to do that. I pulled up a pylorus. The reason why I did that is because one of the number one things that we come across is sonographers like their autonomy, right? We're really proud of our abilities and how well we can scan, so we don't really like anybody telling us too much what to do. So I like to show this Scan Assist. This one's actually very simple because when we look at the pylorus, it's just two views, right? We're looking at the SAG and trans views, and we're just looking for measurements and to see fluid going through. So this is a perfect way to show you that you can use Scan Assist in every facet. Now, do the sonographers all remember the protocol for a pylorus? Yes. But what is helpful for us, for new sonographers, is you can see this reference image down here. You can take your own images, you can take images offline, and you can upload them into your Scan Assist. So this has been really helpful for us with starting new exams, with lymph node mappings, and I'm actually going to show you one of those now. So basically, too, the machines will all set up. They have something called Start Assist. So once your system starts using the Scan Assist, it'll remember which Scan Assist to pull up. So you can see here I have everything built in from their history page down to what I want them to scan. So when we started implementing the surgical zones for our lymph node mappings, that was really tough for the sonographers to learn. That's not something we typically learn in school. So now this is a nice reference image, because even when they're talking and maybe the patient's asking questions, they might forget where they're at. So now if they know they're in right zone 2, we have a nice image demonstrating where zone 2 is, just as like a helpful reminder. And these images don't show up to the radiologist. So this is really just like a learning tool for the sonographers. So I have this in a lot of our pediatric exams to show them exactly what they should be looking for. And when you're going through here, you can set this up however you want. You can set it up so the measurement packages go automatically. You can set it up so every time they take a picture, it advances, or they can have autonomy and advance on their own. So we like our sonographers to take as many pictures as they feel they need, so we let them kind of go in the next order. But the nice thing, and Dr. Sebastiano can speak to that, but no matter if the patient maybe is laying already on their right side and their left side is available, maybe you want to start with their left side, you can just skip down and go right to the left side and start there. But the images will still go to PACS in the same order that we had set.
Right, and in a similar, if you have a new tech or you have a student tech scanning, and then you end up having a more senior tech come in after them, the images will go back to where they belong, because they can just drop it right back in and go back up into the Scan Assist and put the repeat images where they belong in the study for us.
And how has that been for comparing priors?
Oh yeah, that's great, because from the radiologist perspective, everything is in the same order that I say. I establish the order that I want to see the images in, and then since we're getting comparisons, it's nice because it all just lines up when you're looking from the current to the prior.
So this was the first big major step that we implemented to kind of control our standardization, which we felt kind of vastly improved our quality. The next thing I want to show you back on the computer is Viewpoint. So Viewpoint is the reporting system that we use. You can either report directly into Viewpoint, or how we use it at our facility is we basically use it as the communication between the ultrasound system and the PowerScribe 360. So we're using it to have all of our images come through. It'll show you all of your comments. Your measurements will come through. They communicate well back and forth with the machine. And basically, we've controlled what our sonographers are allowed to say. So we all know that this is an upcoming issue with how much the patients have access to their own charts. We don't want them using extraneous, language. We don't want them diagnosing. So we're able to kind of control that. And we've also eliminated a lot of the clicking for them. So I don't know if you guys use, worksheets typically. We were just typing everything out in paragraph form for our radiologists, but now it's laid out in a nice, easy format. And if it's a normal study, all I have to do is go up to this quick report and then hit normal, and it auto-populates everything that our radiologists expect to see in a normal report. So that's it, they're done. So they literally send it to Viewpoint and they're done. There's no extra clicking, and it shows up as a summary here that can be sent directly to PACS.
So Lauren, do you have in one of those drop downs like some of the verbiage, so we can set preset wording for, like, if there's a finding in the liver, if they want to say, so we have it already built in there, what is an acceptable thing for the sonographer to click on. We allow them very small free reign in their own free typed words.
Yeah, and that helps a lot of new technologists too, because they get very nervous on what do they say, how do they say it, how can I describe this? We don't want them calling it, what if they accidentally call something a polyp and that was a boo-boo, they meant, a stone or something like that. So this is an easy way for them to kind of control their verbiage and what they're allowed to say. And we have that, for every single organ, and you can customize it to however your facility wants it.
It's also good for spelling because then you don't
Yes.
get spelling errors. It's already
Yes.
pre-done for them.
The other really nice thing that we didn't talk about yet is from Viewpoint, once you send it out to PACS, all of the measurements come with it. So now the radiologists don't have to dictate every single measurement. It automatically goes right into their report. And if you have it set, it can also bring over comments too. We just don't use that at our particular facility, but it has that ability. We just send our measurements over, so that kind of eliminates some of that error there.
Yeah, we use PowerScribe, and we have very intensive templates. So most of the time, like, I don't feel the need to have the sonographer's verbiage on like liver texture or fatty liver and all those things. I don't generally need those to come into our templates. But the radiologists, we're huge on the buy-in on having all those measurements imported. So now I'm not having to constantly dictate every size of everything into our template. So the radiologists have like a freak out moment if for some reason it goes down, which is rare. Sometimes it just needs to be rebooted, but they love it. They absolutely love having all that stuff just brought right into their report automatically.
Yeah, I do know the second it's down, because I'll get about 10 text messages that minute. Hey, Lauren, my measurements aren't coming across. I'm like, hang on. So it's definitely been a huge satisfier, and I think it's been a huge satisfier with our staff too, because now they know exactly what they're allowed to say. They know the expectation is already set. I think with ultrasound, there's a lot of gray area on what we're allowed to do, what we're not allowed to do. We're expected to give a full preliminary, but sometimes, should we say that? Should we not? So I think this eliminates a lot of the unknowns. So we're going to exit out of here. All right, so when we're looking at our digital solutions, and we talked about Scan Assist already, we talked about our Viewpoint. The last thing we want to talk about is Verisound Fleet. So I believe we couldn't have implemented all these projects without Verisound Fleet. So that alone has helped us implement efficiently and successfully across of our fleet, because we have 33 machines. They're spread out beyond vast mileage. It would take hours and hours and hours to be able to make one single change. And so Dr. Sebastiano can speak to how often our changes were really being made before we implemented Verisound.
Yeah, I mean, previous to having this, if I wanted to just make the smallest of changes, if I wanted to change a label, or, hey, let's add this picture to that scan protocol, let's, put a gallbladder on a fetal ultrasound or something. Any little tweak I wanted to make, there was some serious guilt factor going in there, because Mary or Lauren would literally have to drive an hour and a half to one of those sites to upload that change. So we didn't make changes more than maybe once, twice a year maximum. So, and we also have other specialists within my radiology group. We now have peds specialists and neuro people and MSK, and they all want stuff too. So now it's not just me nagging Lauren, hey, can you go over to that site and add this on all 30 of our machines? So having this has been amazing, because now I get guilt-free changes as often as I want, because she can just take care of it.
Yes.
And she'll tell you how she does that.
Yeah, so when we look at Verisound Fleet, so basically the traditional workflow is you take a USB or, God forbid, a CD, right? And you put it in the system. You have to make a backup, and then you have to carry that physical device to another device, wait for a patient to be done, and then do the same thing with the CD or USB on there. Now, basically what I do is I make any changes I want on any single system I have in the network. So if I happen to be at one site or the other, doesn't matter. I make the change wherever I'm at. I upload it to the Verisound Fleet cloud, and then it gets dispersed out to my fleet. And I can send it to all of them. I can send it to a few, however I decide that I want to break it up. The important thing that we talk about with this is that it saves so much time. So we actually did a study, and they physically clocked me and how long it took to get all this work done. So to get 33 systems, and this is including sleep time and like I'm at home, but it would take 15 hours to complete the updates, and an average of 16 days of work just to get these updates, because you can't hit every system every day all different times. It depends on the patient load, if that facility is even open that day. Once we implemented Verisound Fleet, it was down to 7 minutes and 20 seconds. So you could see the value in the extreme time that I've saved, and now it's more efficient. So now anytime she wants to make a change, or really any radiologist, there's no issue. I can make a change same day and disperse it out to wherever I am. We also use it too as a little bit of a troubleshooting. So if we have a machine that's maybe having a glitch, or they recently got a software update and they accidentally uploaded old presets, that's not a big deal anymore. I can easily go into Verisound Fleet and send it out. So the next thing I'm going to show you is I want to show you what our Verisound Fleet looks like. So here is how our Verisound Fleet systems look. So basically you have all of your assets, which are your systems. Now you can see that I have them already organized because I like to, see them by my site. So if I look at each individual site, you can see I have several in each. Like I have 3 at one site, I have 4 at another. It just depends on the site. But this is the system that's logged in here today. So basically it's showing you that tile of that system. I can easily see that all of mine have been successful, which is great. The ones that are say canceled is because I wanted them to cancel it, or sometimes they're offline if they're shut down. And then you can double click on the tile here, and it's going to show you, it automatically backs up everything. So this is really important for all those like really glitchy moments when something happens, or if they're doing software updates, or they're fixing something on the machine and they call me and they're like, uh-oh, this does not look the same. Can you help me? Yes, I can. So I can easily log in and find the timestamp before they started, doing whatever work on the machine, and I can resend it back, and they can easily have the presets that they had before. So now we're not worried about whipping out the old USBs. I'm not worried about saving backups because it's all right here for you. And then if I wanted to send an update, you can look here. So this is an update I sent earlier this morning called test. So basically I made one change to a scan assist and I send it up to the cloud. This way I can show you, I can easily click on this and I could send it out, and I could push it out to any site I want. So it's pretty easy. You can pick them all, you could pick a few. So you really have a lot of customization there. But Verisound Fleet has definitely been the underdog hero for us. It was one of those things where we implemented, we thought it was pretty neat, but we found that once we started implementing all of these things, there's no way we would have done this efficiently without the Verisound Fleet. So that was kind of the overall bow that tied it all together for us. Any other questions? Yeah.